Hello, my name is Ephraim Aite, the founder of the ReviveStrong initiative, and I'm going to talk to you about the Rafa X solution. So, basically, the ReviveStrong initiative is a social enterprise that wants to leverage on technology in order to offer cost-effective solutions to organizations and address key health issues. So, Rafa X stands as our flagship product, which is essentially meant for health record management. So the team is made up of myself, Ephraim Aite, the co-founder and also a graduate from HSC class of 2017, and we also have Rita Sigba, who is a senior from the class of 2023. Now, what is the problem? What has been noticed is that in the healthcare sector, there's been a gap in technology that accounts about 70% of all health facilities. And also, the research has also shown that startup costs, especially for small clinics, have a cost that ranged around 50,000 to 150,000 Ghana cedis. And in among these costs, they also need to consider when they want to consider acquiring a healthcare management system. This will cost around 20,000. And looking at the fact that they are starting as a business, they may not have the necessary fund in order to acquire such. And also looking at the size of the small health institution, acquiring such a system may not be good for them in the sense that the price will be too much. And another thing that has been noted with the current health record management system, especially the ones that are being used in Ghana, is that the system has not been built good enough for it to give a complete set of records. And the system also requires a lot of training. And also the workflow in terms of the transition from one process to the other is not so good on the system. And this problem affects around 5,400 health facilities, but we decided to focus on the private ones that amounts to a number of 2,500. Now, looking at within the 2,500 health institutions, our focus will be on private clinics, especially on startups, as mentioned, that face most of these problems in terms of them having an affordable health record management systems. And we're also looking at health home agencies who also sell at healthcare providers who are often not served within the IT technology space. And we're also looking at organizations within offices, the clinics within organizations such as school clinics and corporate clinics that will also benefit from this technology. So the technology itself, what is it? So as defined earlier, we are there are health record management systems that are expensive on the market. So we come with one that is affordable, one that is user friendly, and the one that doesn't require the need of investment in infrastructure, in the sense that organization will not need to acquire servers and all those infrastructure, and they will just focus on the application by paying a subscription. And also this comes with a mobile app that allows patients to also use and also exchange data with hospitals. So a first version of the application has been implemented and can be discovered on www.revivestrong.com, where health institutions log in with their credentials. And this is a sample page that shows how patients' records are being entered. Now, in addition to this, we have a mobile application that are more centered towards the patient. So the patient from this can receive prescriptions, drug prescription from doctors, and also have and also discuss with other patients in the form of support groups that are really needed when patients are facing crisis. Now, who are the marginalized groups here? The marginalized groups here are, first of all, the small health institutions that do not have the means to provide a state-of-art hospital management system. And the mobile app that we said complements our solution is also good in the sense that it also serves as a social platform where patients can also discuss and exchange ideas and support each other. Now, how are we going to make money? We are going to make money through, first of all, a free service to the mobile app that will be monetized through advertisements, and a subscription fee for the health institution that will use the hospital management system for a fee of $50 per month. But this is dependent on the size of the clinic and the staff force. Now, in terms of current mind, so what we've been able to achieve is that we've registered the business, we've implemented, developed the platform, and we are currently conducting a pilot with a clinic and a home care agency. The learning opportunities to benefit from, we believe, are learning from experts and individuals in the space that will help us and mentor us for us to be better where we are. And we also plan to learn other organizations that also participating in this challenge, the health challenge, because we believe that learning from each other is really essential. So in terms of current resource available, right now we have an advisory board made of medical doctors that really help us in developing the platform. And we also have a technical team of two students, of two personnel who have the ability to develop the platform. And we have our web and mobile application that are fully operational and are serving customers. So the resources that we need in order to progress are essentially extensive monitoring, because we believe that we are a state that we need counsel from industry experts. We also need to funds to expand the team in terms of having more developers, which will be needed to develop a more robust version of the application, and also need funds to acquire infrastructure servers for our own so that we don't have to host it on the cloud. Because what happens was that there was an issue of data privacy to the fact that we are not the ones hosting the data ourselves. We also need to embark on a sales marketing campaign in order to reach more customers. At this moment, we are not doing any fundraising. Our biggest challenges so far has been the resistance from clients to adopt our solution, the lack of funds to acquire our own servers, and the lack of these business development skills. So thank you for listening to us. We hope that you support us. Thank you.